Picture a patient walking into the emergency room. They have a deep, hacking cough, a burning fever, and they're struggling to catch their breath. To any observer, it looks exactly like a standard case of pneumonia. Usually, a doctor will prescribe common antibiotics, like penicillin or amoxicillin, expecting the patient to bounce back. But in this case, the medications have no effect. The patient keeps getting worse. Then, unexpected symptoms start to appear. Along with the breathing problems, the patient develops a severely upset stomach, diarrhea, and a sudden disorienting confusion. These specific details point to a severe illness called Legionnaire's disease. It's caused by these rod-shaped bacteria known as Legionella. Treating this effectively requires looking past the lungs. It's about recognizing how these different symptoms connect to show that something more specific is happening. When there's an outbreak of a respiratory illness, most people assume it spreads through a cough or a sneeze in a crowded room. But you actually cannot catch Legionnaire's disease from another person. Instead, the infection happens when someone breathes in microscopic water droplets, or mist, that happen to be carrying the bacteria. These bacteria thrive in the warm water of large, complex plumbing systems. In many outbreaks, the source is traced back to industrial cooling towers on the roofs of large buildings, which can spray this fine mist into the air. They also find homes in places we associate with travel and relaxation. Decorative fountains, the plumbing on cruise ships, and hotel hot tubs are all capable of creating that contaminated vapor. In some regions, like Australia and New Zealand, there is a different way to get sick. A specific version of the bacteria is often found in soil, and people can breathe it in while handling potting mix or compost. This means that a person's recent history, whether they've stayed in a hotel, taken a cruise, or spent the weekend gardening, is often the final piece of information needed to understand the illness. While many people exposed to the mist might not get sick at all, the bacteria pose a serious threat to certain groups. This includes older adults, heavy smokers, and people with immune systems that are already weakened. For these patients, a standard chest X-ray isn't enough to identify the cause. To find Legionella, doctors have to use specialized laboratory tests. The fastest tool is the urinary antigen test. It searches a urine sample for specific proteins shed by the bacteria and can often give a result in just a few hours. But this quick test has a limitation. It only looks for one specific strain. Think of it as one particular branch on the Legionella family tree, called serotype 1. If a patient is infected by a different branch of that tree, this test will miss it entirely. If the symptoms still suggest Legionella, doctors can use a PCR test on a sample of mucus. This searches for the actual DNA of the bacteria, which allows it to see any member of the Legionella family that might be hiding in the lungs. Connecting the right symptoms with these specific tests ensures the bacteria are identified quickly, preventing dangerous delays in care. Once the diagnosis is confirmed, the path forward is clear. Doctors have highly effective antibiotics that are specifically designed to eliminate this infection. As this table shows, doctors must choose specific types of medicine. Classes like macrolides, such as azithromycin, or respiratory fluoroquinolones, are used because they can reach deep inside the body's cells to find and kill the bacteria where they hide. Interestingly, some people exposed to these bacteria don't develop pneumonia at all. They get a much milder version called Pontiac fever, which feels like a short-lived case of the flu with a fever and muscle aches. The approach here is very different. Pontiac fever almost always goes away on its own in just a few days, so patients don't need any antibiotics at all. For those with the more severe pneumonia, there is reassurance for their families. Because it doesn't spread from person to person, you can safely be in the room and sit by the bedside of an infected loved one. While it can be dangerous if it goes unnoticed, identifying the pattern early allows for a precise medical response that saves lives. Here is the pattern to keep in mind. Watch for typical pneumonia signs, like a cough and fever, that are joined by unexpected stomach issues or sudden confusion. Then, look at the context. Note any recent history of traveling, staying in hotels, taking a cruise, or being near hot tubs and fountains. If you or a loved one shows this pattern, it's vital to share that history of where you've been and what you've been exposed to with your doctor. By recognizing these unique signs, you can advocate for the right tests and put yourself on the fastest possible path to recovery.